Welcome to One on One, the Daily Items digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Dr. James Chlebowski of the Family Practice Center, interviewed by Marcia Moore.
Hi, I'm Marcia Moore with the Daily Item, and we're here with Dr. James Chlebowski of the Family Practice Center. Thank you.
You're welcome.
Well, let's talk a little bit about what business is like amid the pandemic.
It's been a distinct change in terms of how we have handled things. We're doing a lot of video visits where it's like we try to do almost our same visit, but we're seeing them via video, so we're not able to listen to them. We are able to look at, like, if they have a rash, or I've looked at a few throats on the camera if we can. And so that's been a mainstay of what we do. We do have to still bring in folks that need to be seen, because some things you can't do via video or phone call. And so, but you know, we might see 10 or 20% of our volume live now.
Now, you were talking about a little bit about how you've dealt with the staff, that they've had to take some pay cuts. Can you talk about how you came to that decision?
Well, when we looked at it, we knew we needed to probably furlough a number of people. So we asked for volunteers first, and those either folks that wanted to be furloughed or for some reason, maybe someone who had a medical condition or whatnot. We would say, look, we probably shouldn't have you here, especially on the front end. We just didn't know what was going to happen here, and we still don't. I mean, there's still there's still a grayness to this whole situation. And then we looked at it from there. Initially we were gonna try to have basically give everybody some hours, and for unemployment it works better to have people work a week and off a week, and that's kind of what we've done.
And it's indefinite as this plays out.
Yeah, it's day by day, week by week. I mean, it really is.
Did you learn anything? Because I know a few weeks early into this, there was a physician in another county within Family Practice Center that contracted the virus. Mm-hmm. Did you learn something from that experience?
We did. And so, there wasn't a lot of guidance of what we as a family practitioners should do. And right before that, we were already doing video visits. We were screening people out, but some people might slip through the cracks, might not profess. And a lot of the stuff can be similar. Who do you see? Who do you not see? And it's really, really difficult sometimes. So right after he was, whatever all of that happened, we adopted this approach of 100% of the time wearing protective eyewear and masks. According to the CDC, that way if somebody would come in and cough, sneeze, whatever, they have COVID-19, we're able to still work. We have to monitor. We also monitoring temperatures twice a day. So I get my temperature taken in the morning and in the evening. Anybody that's over 100.5 stays home.
Has that happened? Have you had to?
Not here.
Okay.
We have not had any here.
And again, how many people are working at this? This is the Selinsgrove.
This is Selinsgrove site. What do I have in staff today? I think there are 5 staff personnel, and there's 3 providers for today. But we usually run maybe two providers, 4 staff. It depends on the day.
Well, let's talk about how it's changed. Mm-hmm. How coming to work every day. What do you do differently now that you did than what you did before?
So the biggest, probably the whole mask thing is the biggest thing. In that daily grind of what we do, we also screen people out a lot more. It starts with a phone call at the front desk about who we're going to see, who we're not going to see. and then it kind of moves from there, I guess.
And the people that come in, they're wearing, most of them are wearing
yeah, at least half of them now. That is kind of, since Governor Wolf had made that recommendation, I've seen a definite uptick in the amount of mask wearers.
Are you happy you made that decision?
I am. I really do think that'll make a big difference.
Well, can we talk a little bit about what you perceive will happen with masks, and a little bit about, you made some comments about Hong Kong and Korea.
Yeah, I mean, if you look at other places in the world, they've become a culture of masks, and if you really look at that, that was after the SARS epidemic. So the SARS, which is a severe acute respiratory syndrome, back in 2004, and a lot of those places had not to this level of COVID, but they had significant deaths. And after that time, that's why South Korea particularly was so well prepared, and so was Hong Kong. And they had some things in place, and they were ready to go. And so we're not, and then culturally it became, people wear masks, and people sometimes would say, you would know who's from wherever, even if you, for example, if you're in New York City before all this happened, you'd probably see a bunch of people with masks, and usually they were of some type of Oriental descent, and they would, because that's the culture. It will probably become our culture to some degree.
And you think that that's a good thing, Betty?
I do think it'll be interesting to see what happens next fall, winter. It'll probably be a recommendation, because I don't think we'll have a fully functioning vaccine by then. I don't think we'll be ready. It would be nice if we were, but I doubt that we would be fully ready by then.
But the mask is inhibiting.
It is inhibiting. It definitely does. It definitely is. Anybody who does them, even the simple cotton ones, they're kind of a pain, but it's just going to be part of life.
For you, how has life changed in terms of, you come to work, you don't know what you're working with, you go home to a family, you have 2 children at home. How do you protect them?
Well, the same, basically when I go home, I enter through a back entrance, all my clothes go in the wash, take a shower right away, and go from there. I also used to have a beard for a while. My beard is no longer because it doesn't work with the mask, so I had to go. It's one of those interesting things that had to happen. And then, and I guess I'm monitoring my own self too, because if you would get sick and whatnot, and that would be, a challenge. Although I'm more at risk than they are. It's kind of an interesting thing. It's like, I even learned I was too old to volunteer to go to New York. I actually looked at it, and I'm too old.
No. How old are you?
So anybody over 50, they wouldn't take as a volunteer.
How old are you?
I'm 55.
And they told you that because you.
Well, on the website, they have criteria for volunteering. So I looked at it just to see, but.
When were you considering that, and why was that?
Well, it's just when you read the reports out of there, and I briefly just wanted to see what the situation was and how would one go about doing that.
And your family was okay with that?
I never really got that. I wanted to see if I kind of wondered if they were even taking anybody. I thought they would take younger people. I wondered what would happen there, but so I didn't really discuss it with my wife. It would have been a discussion at that point, but.
So when you see that you're in the risk
age
level.
Yeah. Well, and so there's I know the statistics though too. So there is a jump off of like every decade, and so certainly I don't have any other health conditions, so I'm not high risk. I'm just basically high risk in that dynamic, and so really, if you really look at it, I'm at risk. But and I get that from a volunteer standpoint, because you don't want to create a casualty. So the first is kind of goes back to, I was in the military once upon a time. So you look at you don't want to be a hindrance of something, and that's why. And when you're really looking at it, they're saying, look, we don't want people that volunteers, because then they can become a victim, and then it creates an issue.
They have to take care of you.
It's a different thing if you're already there, and so the National Health Service in England has actually recruited their retired docs to come back because they were just so overwhelmed. And so I think and then you always have to balance that with, okay, what's going to happen here in Pennsylvania, and what will need be. Fortunately, I think some of the programs that the governor instilled upon us have slowed the spread here. I really do think that that's made a difference in his early actions, whether a lot of people don't like them, but I think, you know what, it's made a difference. I really do think that we are, flattening the curves, as they say here.
Quicker than a lot of other places.
Yeah.
All right, we'll take a little break. We'll come back in a few minutes.
Yeah, sure.
And we're back with Dr. James Chlebowski. Thank you. Let's talk about the cases that you've had. You've had people coming through. They've been tested at the Sealands Grove site, at Family Practice Center site. How many people have you sent over to be tested?
I don't know the exact numbers, but our testing sites were especially busy the first few weeks that they've been open. It's been interesting because I think the majority of those people had other disease processes, be it influenza or just other types of viral entities. And so because of the social distancing, not only have we seen that COVID hasn't taken a foothold, but the other diseases have kind of not taken a foothold. And everybody knows that when the kids go back to school, strep runs around and gastroenteritis runs around and all these other viral entities. So that's all been diminished. So we're actually sending less than we were at the start. We haven't had many positives, which mirror what you see in the Department of Health site. Our southern areas have had more cases than here in the central region, which is, again, kind of mirrors what happens in the state. It's just exactly what's been happening there. We've seen.
How have you been able to social distance here at the center with other?
Well, so what we do is with the masks, we're masked and goggled. So really, and we're here working in proximity. So you need a nurse to help you, say, suture a child or something. You can't social distance, can we now? The people that we have to see, we have to lay hands on. And so most of the people that are here, I mean, even this room, we could probably get 6 feet apart, but it would be really tough. So that's where the videos come in. So if we, the video stuff, if we can't do that, we'll, if we need to bring you in, we need to bring you in. I usually delay hands on it. But that's where the masks and the goggles and all this is protective.
Obviously, with about half of the patients coming in wearing a mask, they're taking this seriously. A lot of concern. Are you having, we talked a little bit about why you got into this profession.
I mean, concern for my own health?
Are they expressing any concern?
Oh, absolutely. Absolutely. Yeah, I think I would say there's a lot of anxiety. And amongst everybody, there's a general sense of angst. If you are already someone who just has, if you will, just suffers from anxiety to begin with, it gets ramped up a whole another level.
So how do you deal with those patients?
I mean, you try to. I think sometimes talking with them and talking about what we're doing, what you can do to stay safe, and also about the numbers in the area. I think a lot of people can get caught up in the news cycle. We're not New York City, but we can't ignore this disease process either. So you have to go somewhere in the middle here, and I think sometimes just chatting with them, they seem to it calms down. Sometimes they do need a look and a listen and whatnot, and also the testing. Actually, a lot of the people that we tested early on, they weren't sure, and neither were we. I mean, we set it up, our testing, because the criteria initially from the state were really, really strict.
Right.
And so when we had the opportunity through our reference lab to set up testing, we decided to do it, which was, I think, a really, really good decision. And now it seems like the testing is caught up all along, so it's a little easier to do that.
Is it easier to get tested if they feel like?
Yeah, we've never, I mean, what was fortunate, once we set up our own testing and Geisinger set up its own and EVAN, really, I think this area has never had the problems with testing as other places. And again, it's our volume of patients. We're just not as populous as New York City, let's say.
Right. So what do you anticipate over the next few months?
I mean, hopefully what will happen is there'll be a gradual case reduction, a gradual slowing. Mm-hmm. And I don't think that there's going to be one date. I think rather what you're going to see is there'll be a stepwise, as Dr. Anthony Fauci had said, there'll be the stepwise opening up. That's what you're seeing already in Spain. I think started to do that a little bit. Some of the other European countries are also starting to ease up. China's easing up, but also be very aware if there's a case there, and then immediately test them and track them.
So overall, you've been practicing physician for how many years?
Almost 30 years.
How would you describe this particular experience?
This is probably the most surreal experience ever, I think, for all of us. I think because it's affected. I think it's affected all of us on so many planes. I mean, when I first started medicine was the early days of HIV/AIDS, and that was kind of scary, but not on this level. I mean, there was always a risk. You were especially in the early days. HIV was almost a certain death sentence, or it was like 50%, I think, at first. Which we got through that, and I have a lot of HIV positive patients now that do very, very well. It's pretty amazing how far we've come. So, but this I think has touched everybody so globally and so easily. It's like nothing we've ever seen before.
What do you think you're learning from it?
I guess this new way of taking care of patients. I think the video visit, and that might help us for checking in on some of our frail elderly. If there's a system, there's been sort of this weak telehealth way of doing things, but I think if we can strengthen that, that might be a good way to check in on people regularly. For example, so I still make house calls here. I have always done it as part of my career.
You go to people's houses?
Yeah. And in fact, I saw somebody yesterday. I have one now that I'm seeing regularly. So sometimes I think the difficulty here with house calls is I might have somebody that lives in Liverpool and somebody lives in McClure, and it's difficult to do that on a regular basis. I've always done it for people that are, how should I say, just really, really are homebound and have problems. I think the video visits will allow us to probably connect more with patients on a more regular basis and maybe try to prevent problems. I think that's what you're going to see out of this.
Okay.
I really do. I think that'll be a good thing. And even specialty care. We're in our new project in the mall. We're putting a telehealth suite in there for specialties such as psychiatry, where there's a lack in the area, to do it where it could be burdensome for people to travel somewhere, because there's psychiatrists here. It might take 6 months to see them, and we can get somebody from elsewhere. That a video visit is a lot more efficient. So I think that's probably going to be the big change, actually.
Timing was right for that.
Yeah, I think so.
Well, thank you very much.
You're welcome.
Thanks for watching One on One. Be sure to tune in again for another edition.